Hello, my name is Dr Sal Uka. I am a paediatrician and I'm privileged to be the medical lead within WIAT. I'm going to share some thoughts with you, having spent a bit of time this week reflecting on what's happened over the past 10 weeks. And in particular, I think not only the impact of COVID on what's happened to our populations, but also how we as leaders have responded to that. It'd be fair to say that managing the COVID surge with hindsight seemed a lot easier than what we're trying to do at the moment, which is reset and stabilisation. And I wonder why that might be. It could be because we were all working towards a common purpose. We all had the same thing to work towards. And maybe for one reason or another, that seemed more realistic. But I also noticed that there were other changes that happened. We seemed to be able to kind of implement change without having to have too much bureaucracy and too much debating. And it seemed as if our usual governance processes somehow seemed relaxed enough to say, actually, what is the right thing to do here? What do we need to do to make sure that we're keeping not only our patients safe, but also each other? But I also noticed something else, which was for some people, they saw a natural gap in which they had to fill. They really stepped up. And I think I've seen examples of individuals who have seen those gaps and said, no, actually, something needs to be done over here. And how can we do that together? Clearly, in my WIAT role is all about collaboration. It's all about bringing people together, and it's all about working together towards a common purpose. And I think that was really clear to see around COVID-19. And if we think about some of the specifics, we know that there's been some amazing work that has continued through the Yorkshire Imaging Collaborative, through the pathology networks, but also newer ways of working around mutual aid, because PPE and equipment was shared across West Yorkshire and Harrogate. Having reflected on my own clinical leadership career, sometimes being a clinical leader or any leader of any sort can feel quite lonely. And actually, those existing relationships, those conversations meant that actually there was huge amounts of peer support, and where problems were raised and shared, they were also resolved. But I have to be honest that those relationships didn't just exist within WIAT, those relationships existed throughout the health and care partnership. And I felt really, really welcomed as someone who was relatively new. I only started in post in February into the West Yorkshire and Harrogate Healthcare Partnership. And I've made some really great connections and relationships with people who actually will continue to work with. So thinking more broadly, this isn't just about the hospitals. This is about the whole system in which we work in. And I always have a simple analogy that actually what we have is a jigsaw puzzle. It's a really complicated jigsaw puzzle to look at. And especially if you say this jigsaw puzzle is not just about healthcare, this jigsaw puzzle is about health and the care sector, social care sector. And actually, though, each piece has to go into the right place in order for us to see that picture. And I think the one thing that has become really clear in my mind is that actually we all are one piece of a jigsaw, but actually in order to deliver those outcomes for the patients, for the public, for each other, that actually these jigsaws have to fit in together. COVID, though, has had some awful consequences on our population, not just around Yorkshire and Harrogate, but also across the country and across the world. And we've learned from the data that there are groups within our societies who are more vulnerable. We knew that older people were more likely to sadly die from COVID-19. And we perhaps thought that there would be others who were more vulnerable, but I'm not sure we expected to see the data quite in the way it is. As someone who is of a BME background, to think that actually me or my family would be twice as likely to die from COVID-19 than other who are not of the BME background. It's really quite terrifying. And I think moving forward, what we also need to remember is that we do have health inequalities that sit within our populations. It doesn't sit comfortably with us. It's not a nice conversation to have. But actually, moving forward, those relationships that we've developed have also got to continue working to help those who need it the most. And one thing that I have pledged towards is ensuring that actually, as a result of what we've learned from COVID-19, is that actually we seek out the views of those who actually ordinarily don't always have a voice. It would be fair to say that we're going through a really difficult phase at this moment. Not only are we trying to implement stabilisation and reset, having hardly caught our breaths really from all the planning and delivering around the surge piece, or phase one, if you will. But actually, we're trying to restart services at the same time as still being responsive to COVID-19. It's still there. You know, the peak has dropped off. We are seeing fewer patients being admitted to hospital and then fewer needing to go into intensive care. But fewer, unfortunately, isn't none. So this is a really difficult time for us all, in part because we've been going at it for weeks now, but also in part because actually we're trying to do a number of different things. And I think the thing that we've got to hold in mind, going back to how we responded to the surge or to phase one, is actually holding on to several things. One is actually, let's agree what our common goal is. Before, the common goal was quite clear. It was phase one, it was responding to a pandemic. Well, actually, let's try to be clear about what our common goal is now, moving forward. And also, let's continue to build on those relationships that have developed as a result of phase one. We're already working in a different way. We're already starting to see things from different perspectives. We're already trying to ensure that actually we're seeing things from different lenses. Well, let's not lose sight of that, because actually that not only got us through phase one, but it will continue to get us through future phases as we go through the rest of this year and into the future.